Students are the future. Our well-being has to be a priority, especially as university is a time where many students face new academic, social and financial pressures.
You might not know this, but like race and like climate change, we are in the midst of a growing mental health crisis. This might sound a little overdramatic, but the evidence shows this to be true. We can't hide from it.
This can be difficult when you're living away from home for the first time, and especially for BAME students like myself who might find it difficult to see themselves represented in their universities.
We know that universities are facing increasing challenges around student and staff mental health, but we also know that there is some truly excellent practice out there, and that by working together, we absolutely can meet those challenges head on and create a higher education that is good for mental health. That's why Student Minds developed the University Mental Health Charter.
As a student with lived experience of mental health difficulties, I believe universities should adopt a whole university approach to mental health. This means thinking beyond just isolated mental health interventions and services to coordinating cultural and structural change across the whole university, so that mental health is promoted for everyone across the whole student experience, from assessment to accommodation. The mental health of students and young people has been disproportionately impacted by COVID-19. Now is the time to prioritise student mental health so that students can adapt and thrive.
The Charter combines the latest evidence with the perspectives of thousands of students and staff and sets out how we can make mental health a university-wide priority. The Charter programme brings together universities committed to this work to keep learning from one another and improving their practice. Programme members can apply for the Charter Award, an opportunity to identify and celebrate outstanding approaches to mental health.
What better place than our institutes of higher learning to proactively respond to this predicament, and in the most conscientious and openly responsive way? At UAL and in many other institutions across the sector, we are finally beginning to understand the importance of meeting this head on by taking an inclusive and systemic approach to combating mental health stigma and supporting the most vulnerable during these most significant times. Although not the only show in town, the Student Minds University Mental Health Charter Programme provides very useful guidance on how to best go about doing this, and I wholeheartedly support their endeavours.
Universities are inspiring places to be. They transform futures and they create opportunities. But we also know that they're places where we need to take care of people's mental health and well-being. To do that, we have to think of mental health and well-being as everybody's responsibility. We have to think and act strategically.
The Charter provides a springboard and framework to support and guide colleagues to offer students the best possible care whilst at university, and builds organisational resilience and consistency by following a holistic whole university approach. The programme offers experts in this field and higher education practitioners the opportunity to come together and identify areas for improvement, as well as gaps in support provision for all student groups. The Charter is not just another thing to do. The thoughtful and consistent approach taken by the project to create this programme of support through wide consultation with the sector creates an ideal environment for participating institutions and the sector as a whole to work towards continual improvement in mental health support for students. That is why I'm supporting the University Mental Health Charter.
Engaging with Student Minds in the Charter pilot has been invaluable in allowing GCU to evaluate our practices in supporting student and staff mental health, and in embedding our whole university holistic approach. We are truly grateful to the assessment team for all their helpful feedback. Our staff and students very much enjoyed the experience, and we are well on our way to preparing our submission for formal assessment for the award. We hope, as others go through the process, there will be more and more opportunities to learn from each other, and we are looking forward to sharing some of our own good practice as we continue to work with Student Minds.
Now, over the last decade, Universities UK, working with partners across the sector, have tried to ensure that we invest and understand how best to allow people to thrive and flourish with good mental health and well-being. Student Minds, the Mental Health Charter, offers us an opportunity. It gives us the chance to make a transformational change in the way in which we support students. It's a great framework, And alongside the Universities UK Mentally Healthy Universities framework, it gives us the possibility to accelerate the great work that we're all doing, but it also allows us to learn from each other. This is a team sport and a collective endeavour, and we need to make sure we don't lose the opportunity.
It's important that universities help students know that their experiences are valid and that help is available, no matter what they look like, where they come from, or what they're experiencing.
And I really hope that universities across the UK really engage with the Charter. Take the Charter, use the Charter to influence your thinking and work in partnership collaboratively with staff and students to do the best that you possibly can. This is an opportunity that we mustn't miss. It gives us the chance to transform futures. I'm delighted to be able to support the Charter, and I look forward to continuing to work with Student Minds to do the best that we possibly can for our future generations of students and staff.
We truly believe that together we can rewrite the narrative around university mental health and create a future in which everyone in higher education can thrive.